Okay, good morning everybody. Once again, my name is Zoya Yevsikova. I'm a plastic surgeon and dermatologist. Currently I stay, live and work in Moscow, but I think that in the nearest future we'll work here in Israel. So today I would like to explain you how to work both of this machine, both of this device. With Aerolase Neo I work approximately maybe 12 years. It was my first laser in my clinic, and during it was the only one laser, like mostly of you. I have no more nothing. Now in my clinic we have 13, 15 different lasers for every condition. And of course, you have to understand that every machine, every laser have special indications, and very important to take the true patients for your procedures. You can't make all procedures, all indications, all diseases to treat by one machine. It's unbelievable that this machine will exist in world, because we have different type of energies, pulse durations, a lot of pigments, for example, yes. And today we will speak about neodymium laser. You know that neodymium work with two types of pigments. It's a melanin and it's a hemoglobin. It's very important because when we speak about resurfacing lasers, we work with water. For example, erbium, don't see melanin, don't see hemoglobin. It works with water and collagen. So the first is neodymium laser. The main advantage of this laser is a short pulse duration, 615 milliseconds. Because of this short pulse, we don't receive overheating of our vessels, and we could avoid burns. I showed previously how we can work only with melasma. I will explain once again how we work only with vessels, and how we could even work with open wounds. It's a very different indications, very different protocols and lenses. So, of course, when you work with wounds, when you work with vessels, you have to know very important process. It's a wound process. Because when you understand this stage of this process, you have to change your protocol directly. For example, first stage, first 24 hours, 15-24 hours is a hemostasis phase, when blood clots formation exists, and even in this phase you can use neodymium laser. And on clinical cases I will show you these protocols. After we see inflammation phase, it's approximately 3, 5, 6 days when in this process we see cell migration to wound. We see many different types of cells, and we have to maintain this phase, because cell migration is very important process. It's not only macrophages, it's a fibroblast, it's a stem cells. So I like to use stem cells from adipose tissues, for example. You can use growth factors to maintain this process. After inflammation, cell migration, very important process. I think it from 2 weeks from wound from injury, it's a conversion fibroblast to myofibroblast. You know what is the myofibroblast? It's the cells which have like a hands from alpha actin. And if we have a wound, for example, one board, second board of wound, edge of wound, and how in English, I don't know, the floor of wound. And fibroblasts on this edge of wound grow this alpha actin hands and bring edge to each other because of this protein bridge. And when the edges of wound come each other, we see growing of scar up. Yes. So this process we need. So we have to maintain becoming fibroblast to myofibroblast, and after, when we see granulation tissue, synthesis of granulation tissue, what we have to do? We have to coagulate this granulation tissue. So, you understand? Because we don't need, we don't need hypertrophic scar. So, this stage, hemostasis, inflammation, cell migration, and fibroblast conversion to myofibroblast, we use only this lens. It's a collimator lens, only collimator. And after, we start to use these lenses, focused, in order to coagulate vessels inside of scars. This first. On clinical cases, I will show and you will understand. And of course, when we work with old scar, for example, for me, old scar is a 6 months and more. It's not a 1 year. And when I speak with other surgeons, other plastic surgeons, I told that we have to treat scar on first days after surgery, not from year. It's very important because if you, the earliest starting of working with scars will bring you the more good results. This I told you this morning about polarization of macrophages. It's very unique process, very interesting process. When we have a wound, we see cell migration. And in wound, macrophages from phagocytic cells, macrophages M1, polarizate to macrophages M2, which have proliferating options. There are proliferating cells, so they stimulate secretion of angiogenin. Angiogenin is a growth factor of vessels. So vessels is a blood supplying, is a prophylaxis of ischemia, stimulating migration of fibroblasts, and this fibroblast secretion angiogenin. So it's like a circle. So macrophages, it's like a main cells in wound process which supervise all cells and all processes of angiogenesis. And in my research work, I see that using collimator lens stimulate macrophage migration to wound. So it's when I made wounds for mice in laboratory experiment, and hit these wounds by collimator lens. It was just mode 4. It's at 20 joules on square centimeter. It's not high level of energy. And after we make samples of skin and see under ELISA method, when you make radio frequency markers on cells and see which cells come to wound. We see a big quantity of macrophages in wound. So we understood that it's not a first time I saw that it's just like artifacts that maybe because of hating, I don't know. But now we understand that it is not an artifact, it's real biochemical process after using low-level laser therapy. Sorry for my English. If you don't understand, I can speak on Russian and somebody will translate. Okay? Here I would like to explain that we have to work with wounds intraoperatively in early period, postoperative, from second day, and in postoperative period. So it's very different protocols, but we have to make prophylaxis of scars as early as possible. The differences, you know that it is a very, very old method. We have a lot of energy-based devices, and for example, if we use non-coherent lenses, it's a little. This one is like a lamps. This one is like a LED therapy. We use LED therapy for. I know you have a lot of machines, photobiostimulation, a lot of colors, red, blue, yellow, a lot of mask. It's a LED therapy. And when we use lasers, neodymium laser, we have collimated beam. You see that collimated after going through glass. We have white and low and lowest energy beam, and when we use coherent lens, we have more focused beams. So on this case, we have a very big quantity of energy in small point, so we can treat vessels diseases. But about vessels, if it is a diseases like wine stains, port veins, it's better to use lasers with dyes. Cuprum, красители, VBIM, yeah.
Pulse dyes.
Yeah, pulse dyes. This laser, it's better to use with small vessels and better for inflammatory vessels. So acne rosacea is really good indications. And for melanin treatment, because melanin and hemoglobin are very close to each other pigments, which are concurrent for this energy, focused energy. So I told you, and now I want to explain one more time. You have to use glass. I will show you this glass. It's like this one, you know, for like in laboratories, you know, like a typical laboratory glass, you know. Okay. And предметное стекло. This one. You have to take this. And when you put this glass on pigmented area, for example, I have a pigment, you see white coloration because blood is pressed by this glass. Mm-hmm. And you take a lens, for example, and work on glass. No gels, no liquid, only glass. And you will.
But we have to press.
Yes, you have to press.
And here you can even use the 2 millimeter.
Yeah.
Power 10.
For 2 millimeter, 10 is very aggressive. It's approximately 350 joules on it's maximum. Yeah. I think you have to start from 4.5 mode and go up. But this protocol is effective. When you use normally on melasma, you will not see result, of course, because the most of energy will go to vessels. Because hemoglobin is more strong pigment for neodymium laser than hemoglobin.
If you use glass, you see result even in melasma?
Yes. Not one treatment, but I see, and for me, what I make, I have a lot of ablative lasers, so I peel off the corner, yes, peel off little bit epidermis, and after use protocols with this machine or Q-switch laser. But if I work with Q-switch laser, it's a picosecond neodymium laser, I use glass too. And after I use my patient's home care is a home microneedling with tranexamic acid and hydroquinone. You know hydroquinone. And they input.
Which
mode? 4-6, from 4 to 6. Yes. Okay. Low-level laser therapy. It's a therapy which we receive because of using only collimator lens. It's my favorite lens because I can treat with it psoriasis, seborrheic dermatitis, alopecia areata, and for example, my patients from surgeries, I maintain hailing because of cell migration. So I use from 4 to 6 mode. It's very low parameters. You can feel a little bit head, but little bit. So you can use it on open wounds. On my clinical cases, I will show how we work with open wounds with this lens. So it works because of migration of macrophages, and low-level therapy come to dermatology from neurosurgery. Neurosurgery and orthopedic was the first medical specialties which used low-level laser therapy in chronic pains of back, in problems with connective tissue, bones problems, and after come to dermatology and you see effects. It's really workable procedure. So you don't need nothing, only laser. Here I put from my research work which parameters we can use in different phases of wound process. Exudation phase, regeneration phase, it's the same that granulation formation. It's the first month. It will be easy for you. First month you use these parameters, and after, of course, when we have a scar, we work with coagulation lens, focused lens. This one. In early phases of wound process, for example, day of surgery, or day of wound, or day of, I don't know, you make ablation procedure, and I show you how I make an ablation, and immediately after use neodymium laser, or peelings. It's the same. Wound. You make a wound, and using very small parameters, 13 is mode 2. Mode 2, mode 5. From 2 to 5, collimated objective, this one gold. And day after day, one pizza, one pass per millimeter, without без нахлёста, как это сказать? Yeah. And after, you can make more strong, more overlapping, yes. And when our scar maturation and remodeling, we see scar, we take focusing lens. I prefer use 2 millimeters, it's more aggressive, more useful. And this is the days from second month, and every month you can use these parameters. Next table, for example, for 2 millimeters and to 5 millimeters collimated lens, you see these parameters, mode and joules. It's, this table can explain you for understanding the differences between energies. So these parameters, I think for 36, it's low-level laser therapy in open wounds, in hair stimulation, growth stimulation, and from 40 and higher, it's parameters for work with hemoglobin, melanin, and with hair removal. But honestly, if you would like to work with hair removal, in our clinic we don't make hair removal. It's not interesting for us. But my colleagues, which love in hair removal, of course they use alexandrite for black. Alexandrite. A lot of people in Israel have strong black hairs, and alexandrite is more better than neodymium laser. But if you have only neodymium, you can use it, as I previously told, but alexandrite is just one session. Of course, more complications from alexandrite and burns, even if it's a skin with 4-5 Fitzpatrick phototype. If you have, like me, white skin and black hairs, alexandrite is perfect. But if you use treatment for patients with 4-5 phototypes, I think you have to use more mild procedures in order to avoid overheating, and immediately after procedure use cooling packets. This is not interesting, it's from my research. I make different types of wounds. Okay, I know, I think that all these advantages I told, and the risk of burns and pigmentation is reduced because of short pulse. So we don't have overheating, distinguished with traditional neodymium laser with long pulse. It's, for me, it's safer. for me it's safer, I'm calm, I sleep calm and know that everything is okay. But you, of course, can receive burn when you treat vessels. You start to grow, to up your parameters, mode, using this aggressive lens. And for example, on mode 5, you don't see result. On mode 6, you see a burn. So for me, it is better to use glass 2, make mild pressure and work from big vessels. You see big vessel and small vessels are closed. It's more controlled procedure. So I will show. Okay, clinical cases are very different. I have a lot of, and I will show you how I treat stretch marks. Of course, the first, I take a micro-needling device. I see that you have a lot of micro-needling device. Here you take and make a wound. I will show you wound like this. Yes, it's not home care. It's a really a workable procedure. You make a... But machine? I have a 5 millimeters. 5? Yeah, but 5. I have I have a machine with 5, but 1.5, 2 millimeters. But you can.
1.5. Okay.
It's not like a massage, of course. But when you remove blood, it's okay, it's normal. So, let me show you. This patient came to me with stretch marks, with skin laxity. I have to use this wound. It's very important. And as I previously told you, how we work with wound? We work with collimator lens. So, after I take collimator lens, and this is just yes, it's the same. It's the same. And after you can put, for example, cream, healing cream, or I prefer to use dressings, semi-permeable dressings, which are good for air. Our skin is breathing with these dressings, but the lack of exudate adherent by this dress. I was from carboxymethylcellulose. It's a special dressing. So 2 days after procedure, patient sent me photo. It's like an inflammatory phase. It could be painful, not strong, but painful. Maybe a little bit warm, like yeah, immediately in one session. Yeah. So we make a wound, and in this no focus. Yes, yes, because we need cell migration. It's a low-level laser therapy. We make low-level laser therapy. And from 1 month, it's not a discoloration. She was with tan, yeah. And 3 treatments. You see, look at her area of, you can see lifting, very good lifting. Only needling and only collimator lens. No injections, no collagen, no peptides, nothing. Because she was planned pregnant, and we decided not just, even for pregnant women, I use both needling, both neodymium laser, it's okay. And if the patient have a fresh stretch mark, for example, pregnant woman on 8-9 months with this red or blue stretch marks, it's very, very effective use this laser, even one procedure. No injections, so you can use it on pregnant women too. This lady from 3 pregnancies, she have wide stretch marks. So I used for her microneedling too, and after we use injections, or it's the same patient, but it's a mammary gland, and it's before procedure, and after this is before too. After procedure, I make maybe after 2 or 3 needling injections of stem cells from her fat, autological stem cells. And you can see 1 month from 1 macro needling, more strong skin, not so wide and not so deep, before and after. Of course, actually, you can see the skin quality, pigmentation. You see, we work with pigmentation too, because my needling was very aggressive and it was very strong wound process. So this patient is this next patient with old stretch, very old stretch mark. It's a little bit difficult, and she had a complication. If you see dark coloration, it's like a melasma, post-inflammatory hyperpigmentation after CO2 laser. These dressings, about what I told, semi-permeable, it's a Austrian company, Suprasorb, you know. This is carboxymethyl cellulose, white, and this film is a semi-permeable, not permeable for water, for blood. So blood stay inside wound. It's very good because our blood, it's a better regenerative product. We have all we need for regenerative, and but the most of this liquid absorbed on this carboxymethyl cellulose. And I leave these dressings from 1 to 3 days on patient wound, and they in home peel off this dressing and just use only topical products. This patient had 3 microneedling procedures, aggressive of course, but and low-level laser therapy. Very good result, and actually after our treatment she was pregnant again, and her skin was very dense, very good quality of collagen, and no receive once again stress. This is the fresh stretch marks you see. This patient after pregnancy, and we made abdominoplasty. You see the fresh scar, but look at her stretch marks. Just 2 procedures, just 2 microneedlings with low-level laser therapy. No injections. And of course, I started to work with scars. Fresh wounds. Mostly patients I have from my surgeries, of course, but not only from mine and from colleagues. And on fresh wounds, I use only this lens, collimated lens. Of course, for this patient, I use 6 treatment of low-level laser therapy apart 1 week. The first procedure was in day of surgery. And after we make few treatments of CO2 laser or ablative, or you can use peelings, but of course lasers is better for mild skin resurfacing. The same, fresh scar, you even see hematomas. We remove sutures and start to heal her. 5 procedures apart 1 week, each other, low-level laser therapy, and 2 procedures for resurfacing. And actually, she don't have a scar. You can see here the mark from lingerie. It's not a scar. Please, very good indication is after blepharoplasty scars. For me, it's because very thin skin, very good results. Just 4 procedures, only low-level therapy without skin resurfacing, without ablative procedures. Only this one, this. It's the same.
With 6 millimeter?
Yeah.
How much power do you
Power on fresh, mode 4, 20 joules on centimeter. Very low energy. Because we have a lot of pigment, a lot of hemoglobin. If you will use 6 or 6.5, you can receive a burn. It was my mistake first time. So better start from 4. And patient will tell you that even on mode 4, it's little bit painful. But little bit painful, it's okay. It's okay. It's normal. When I make scar excisions, I work on this day, put suturing, and you can safely work with sutures on skin. It's pigment in prolene, this not disrupt from laser. And the same. Every week, every 5 days, you make this treatment, and this scar was a keloid, a very deep keloid with ligature holes. And previously doctor, this patient from Sweden, and she had many treatments of corticosteroids injections, and we see this is a hole approximately to mucosa. It was very difficult scar, so I make an excision, and after start to work with neodymium laser. But I don't know how it here now, because after 2022 year, boards for Russia was closed, and she didn't come from Sweden. This patient had benign tumor. It was a myosarcoma, maybe myosarcoma on head. So it's it's not aesthetically surgery. It's a flap. Here was this tumor, small tumor, but oncologist makes this flap. You see hairs from this side. Yes, it's like a rotational flap. So when we come to me, I was shocked because it's very rough work by surgeon, but it's okay. So we see this is named dog's ear, when skin close, like, yeah. Oh, sorry. This one problem. The second problem is hairs. And the next problem is this necrotic zone. Of course, we make excision of this, because you see that her brows are on different layers. We start to make hair removal and work with area of necrosis, and after we start to use CO2 laser for ablation for skin resurfacing. So this patient, I was treating her, I think, 2 years, because we have intervals between CO2 laser, 3-4 months. 3-4 months. First stage, when I used only neodymium laser, it was 2 months approximately, 5 procedures. Here is not fully anamnesis because it will be very long, so just want to explain you understanding the processes of treatment. This patient come to me after dog bite, and we remove stitches, and this is the zone of necrotic. Start to work with LLT, 5 weekly treatments, and after add CO2 resurfacing, and you see it's not this result was after, I think, maybe 1 year of treat her, and now she texts me that next 1 year result is better and better, but we don't we didn't treat her. It's because of regenerative process by herself. Yeah. It's very important to start to work with fresh wounds. This patient, the same dog bite. She came to me with hematomas, with scars, and here of course, here on this wounds I used botulinum toxin because of tension of this area, because orbicularis oris is a very strong muscle, and this muscle can stimulate scar growing. So we use botulinum toxin around our scars. The same, you can see that no injections actually, only collimator lens. The same protocol, the same. So fantastic result, I think, because I was shocked. I thought that maybe little bit marks we will see, but no. This guy, young guy, have a wound in his home and fully on all layers. We put suturing on mucosa, on muscles. Actually, is a corpus adiposum Bichat. And we used LLT, and you see, no ablative procedures. He's a guy, he don't want to feel pain, to make injections, and we see very good results, and even stimulation of hairs. And when I ask him, maybe you want to make reservation? No, it's okay for me. Thank you. This fresh wound on forehead. After 5 treatment of a low-level laser therapy, we see small mark of wound. And this patient texted me in Instagram. She work in film industry, a cinema company, and no need. She told me that she no need reservation because after our intensive procedures, skin long time regenerate by itself. This is a burn on body.
When you do session 2, session 3, you make more energy?
Yes, yes. The main rule, the less quantity of pigment need more high level of energy. Yes. About hairs, the same. Black hairs need less energy than brown like my or red, for example. Edema after rhinoplasty. Now it's very popular surgeries on face, rhinoplasties, and patient often complicated by long-term edemas. 2, 3, 4 months they go with edemas. It's their breath is complicated. It's very difficult. So what I do, I put beam of laser inside nose. I use, for example, mirror like in otolaryngologist, you know, and put beam on. Or you can use spreading like a cotton pad, cotton. This, yes, just to work with septum, and if you will, if it's white nostrils, you can effectively work with turbines. With mucosa, okay, with mucosa, just with mucosa, and on skin. So you make heating. Actually, if your patient have a sore throat, I remember now, you can work with tonsils. Very effective, because neodymium laser also have antibacterial effect. Yes, it's very effective. So I make these procedures for my children. Just 2 treatments. 3 treatments. No injections, no steroids. This is a swelling after secondary rhinoplasty. This one. And we make 2 procedures. And look at her, the same, 4 treatments. This is my article about these procedures, how it works. It's in Russian, but I have the article in English. If you will interested, I will send. I have a lot of articles about laser therapy. This this after.
Maybe before.
Yeah.
That's what we saw yesterday.
Yeah, maybe it's yes. This patient. It was a necrotic process. It was a necrotic process after languette from after surgery, and here was a wound, and in this patient, after I make it's this stage is just a neodymium laser in order to work with vessels, but after we used CO2 laser and injection of collagen matrix, of course, because there are empty space. Very interesting.
Just go back to the strand. We saw, I just asked, we saw the good result of skin tightening. Do you use it also on face and neck?
Yes, yes.
It should be good also there.
Yes, I have in my Instagram, I have a video. I will show how I work on face. I love needling.
זה מצוין, שם מיקרונידלים ועוברת עם Aerolase, עושה 3 כאלה, וזהו. מותח את הפנים.
עשינו הפוך, עשינו...
This video you can find it and I
הפוך, צריך שאחרי שיש חורים, הוא נכנס...
אם יש דימום...
I make needling.
אז הוא מרפק את
реакция уже хорошей трофикой. Если это первая процедура на
сколько
рубцовой
тут?
ткани,
2 миллиметра?
2.
они
Yeah.
прибыло
Yeah. Да.
потому что рубцы объединяют
והמיקרונידלינג הראשוני בלי כלום, בלי חומר, בלי...
לא, אם תסיים לה.
לא.
And after I use neodymium laser and dressing still.
You make microneedling, after this you make Aerolase
After microneedling, neodymium laser.
with the
Yes, collimate. Yes,
lifting.
yes.
It's not to make a effect of tattoo. because we
No,
have
no,
a blood.
no effect of tattoo.
это направлено на то,
They also
So you have to make. Да.
знает, какая рана, большая, маленькая.
Ой. You can find it.
They also should put the dressing on face.
Yes, every time. Yes, I use.
רק צריך למצוא מה יש לנו בחדשות, משהו דומה.
There are many videos and photos you can find. So, I love to work with acne scars with this protocol. Needling, injection of angiogenin. It's a Russian product. It's like a VEGF.
No, we need to look what we have in our country for this.
Yes, it's a Austrian dressings. It's not Russian. It's Austrian. Suprasorb. It's a surgical dressings you can buy and use.
איזה הכי נוח שנדבק כזה, זה משהו שנדבק ולא זה.
Keloid scars. Keloid is a special scars which have a lot of insufficient pathological vessels. So when we work with keloid scars, this keloid scar is from cryo sculpting machine, Chinese, very from AliExpress. Yes. And after one procedure, she received this small spice is from skin transplantation, but and all this area was healing under secondary tension.
And we can use it for all the keloid scars.
Yes, but firstly, I inject in
Like new one.
which one?
This picture, it's a new keloid scar. It's not something old.
It's a 1 year old. Yeah,
But if we have more,
old.
yeah,
It doesn't matter. Keloid scar is a keloid scar. 1 year, 2, 10 years, it's the same. It's a pathological object. Actually, nowadays, keloid scars are like benign tumors, and we have to treat keloid scars like tumors, not like
Because
so.
the best treatment is radiotherapy.
Yes, and
We don't have it in clinic now.
I use injections of cytostatics,
Which
bleomycin,
one?
bleomycin.
I also use bleomycin.
So this patient, I injected bleomycin. I inject her bleomycin. 1, 2, 3,
Bleomycin works better than
5 Toracil.
and
Yeah.
and 5-FU also better.
Yes, Kenalog Diprospan, no work here, no work.
Bleomycin.
Because when she came to me, she told me that he was performed 8-10 procedures of Diprospan.
In the ampoule of bleomycin, how much saline do you add?
In one ampoule, 15 millimeters of saline,
15.
15, yes.
So it's diluted because
Uh,
the ampoule is small.
I don't know, in Russia we have 15 milligrams in one vial.
לא, לא, bleomycin זה כימותרפיה.
במקום ה-5
אפשר להזמין בסופר פארם. אפשר להזמין בסופר.
I will show you now.
What concentration?
15, 15, 15.
15
Yes,
milligram per ml?
15 milligram, yeah. We have 15 milligram, this is our product, 15 milligrams, so it's 1
But
milligram
it's-
and 1,
But is it 15 milligram in one ampoule or
Yes.
in 1 ml? In one ampoule.
in 1 ampoule. So I take 15 milliliters of saline, 1 and 1.
So you have 1
yeah.
milligram per ml.
Yeah, yeah. Very easy to work.
הם שמים 5U ו...
5-FU זה בולשיט, זה לא זה. באמת, אני הזרקתי כל כך הרבה 5-FU לקילואידים, זה לא כמו מים. וכן הלא, ומה שאתה רוצה, זה כמו מים. זה רק
אבל עכשיו
מה
השולט
שהורס
על
את
המוצר, מה שאומר. כאילו לא אומרים זה.
אבל היא עושה גם ארולס.
And in procedure, after injection, I use coagulation lens. For what? In order to coagulate all these vessels.
What lens do you use?
No, focus. Coagulation.
Which one is the 2?
No, I prefer use 5 because bleomycin is aggressive, very aggressive, and a little bit afraid to receive a wound, so 5 is okay.
5 millimeter.
Yes, yes.
And what power?
From 5.5 to 6.5. It's
And it's joule, right?
mode. It's a mode.
Fluence.
Yeah, fluence, yeah. But you have to understand that keloid scars, it's scars without blood supplying. So if you use injections of cytostatics, you can receive wound, open wound.
But that's okay.
Yes.
Because that's how it goes.
Yes, but for me it's not a problem because
Then you treat.
immediate treat, of course. But you can have to explain your patients. For example, this is a fibrin after wounds.
The yellow.
Yes, it's a fibrin.
Do you prefer to use 1.5 millisecond or 650 microseconds?
650, yes.
But if we have hypertrophic scars after operation,
Yeah.
we can use the same protocol?
Please, if it's a hypertrophic, try to start with steroids. Steroids more safe, more predictable. Bleomycin is a high level of treatment because it's more aggressive. Or you can take 1 milliliter of bleomycin, from our 1 to 2. Yeah. More diluted. It's okay.
Like more diluted, it would be half milligram.
Yeah.
And the with chromated
No. I use focus lens. If we work with hypertrophic and keloid scars, I use focus lens. Because we no need low-level laser therapy, but if after injection you will see wound, you have to use low-level laser therapy. But if it's a roof scar, you no need.
And how much session are needed for
6
six sessions for this keloid?
for this.
So
Yeah,
each session you inject bleomycin,
every session.
and do you use also Aerolase?
Yeah.
What parameters?
Focus lens, 6 fluid, mode 6. It's
Are you doing many passes or
yes, many passes.
we need to see some reaction?
Some little bit, white coloration when we work. Yeah. It's the same keloid scar after car accident near nose, and it was very rough scar, steroid resistant scar. So I use the same bleomycin, and you see the flattening. These vessels, you know that keloids have a lot of vessels. So I think a very good result. And after we made CO2 resurfacing.
Is there a difference with keloids on sternum or on shoulders?
The same. I work with sternal shoulders. Difficult area because it's a joint of and a lot of movements like up the joints. But it's work too. It's work too. If you have very big keloid scar, you have to use verapamil injections, blockator of calcium channels. Little bit painful, but no side effects like from bleomycin. So you can use more quantity of this product. It's verapamil. Verapamil, in Russia we have verapamil in only one type verapamil. They're pre-diluted, so you just take in syringe and you can use, but it's really painful, so it's better to mix with lidocaine. The same. This typical hypertrophic scars after mammoplasty. You see the nipple area. Yes. And you see it's not keloid, it's a hypertrophic scar. And we make few procedures of injections, and these vessels is better coagulate with glass because they are very big, and when you press, you will see only big vessels, not, for example, like this.
So this is hypertrophic scars?
Yes, it's a typical hypertrophic.
And here you use Canalog and Aerolase?
Yes. These scars no need bleomycin. And after hypertrophic tissue removal, we start to work with collagen injection and CO2 laser. In this case. In this, no. Here you can, of course, you can use next vessels procedures, but for this patient, it's no use, only neodymium. This is about cellulite we speak today. When I started to work with cellulite, I have several modifications of my protocols. Firstly, I make tumescence. After tumescence, use it's a Klein solution. After tumescence, I take cannulas like this. This is a thread. Yes, 19 gauge cannulas. Separate fibrotic subcision. Yes.
Extension.
Yeah, yeah. And low-level laser therapy in order to enhancing skin of skin tightening, cell migration. You see results. And you know ultrasonic cavitation machines in our clinic. It was, I think, 10 years ago. We used Ulfit. You know Ulfit?
Yeah, I heard. It's only in Russia.
Really? Very good machine, very good device. Because when we make subcisions, make heating with neodymium laser, very easy to disrupt these fat cells connections with cavitation.
You use
But-
subcision with material, with Jalubro, Charisma?
No, nothing.
Line?
Nothing injection, no injections. Just anesthetic solution.
Thomasen?
Yeah.
You don't use pump, right? You just
Ah,
hang it
now, yes, it's like
without pump.
without, yes. Pump could be a little bit aggressive, and if patient don't have general anesthesia, for him it's painful.
Just gravitation, just
Yes,
it's enough.
yes. Of course, you need more time, but patient is calm.
And you insert it with the same cannula of 19
Yes.
G, right?
Yes.
And energy is standard?
For low-level laser therapy, yes, it's a collimated lens, and here you can use energy even mode 8-9 because it's a cellulite tissue. It's not a scar. It's not a wound. First, second, patient it's not painful because under local tumescent anesthesia, and water is a good
Absorption.
for head. Yes, and he go home with and procedure.
Compression garments.
Yes.
Компрессионное белье.
Да.
Мехатев.
Не так. You haven't used special after surgery. You can use sportive leggings. Спортивные можно просто. Не обязательно прям.
Ну, не такие, которые после липосакции.
Да. Помягче. Конечно, да. Here you see we work with cavitation, not only with cellulite, but with cavitation too.
Can you say that you said that later that now you use the neodymium
Fiber.
There are powers in the fiber. There are numbers, right? In power. What number usually in a photona, for example?
In joules, it's
No, in the cellulite on the body.
yes. My parameters are from 300 joules per centimeter to 500. It depends of the cellulite, but it's very aggressive.
And what is the maximum there?
550 joules. 550.
Is the fiber you use reusable, sterilizable? Or
Yes.
You have to
Yes. This is reusable. In my nurses
sterilize.
sterilize specially, and of course you can cut. It's very
You don't need cannula for guide.
no need.
You just
No.
use fiber.
Yes, yes, because it's a flexible. You can make very precise. Actually, I work even with ice. If it's for example, after lipofilling lower eyelids, we see irregularities. I take this fiber and very fast work inside. Or biopolymers in lips.
If you compare the cannula, the blunt cannula without fiber and the fiber, so which
Fiber
one?
is
Fiber is
more effective, yes. More aggressive.
Tightens the skin.
Yes.
Better subcision.
Yes, neodymium laser hitting inside picofuscin in adipose tissue. It's a good good target for neodymium too.
תראה איזה תוצאה.
A lot of patients with. You see very good skin tightening. And I think that for dermatologists, it's very interesting how we work with acne and rosacea. And my first medical patent is based on rosacea treatment. This patient came to me with steroid-resistant rosacea many years, 15 years. She used creams with steroids, Sinaflan. And first time she saw result, but after she received steroid-resistant rosacea, rhinophyma, and came to me. And I saw on her skin like on skin with tumors, vessels tumors. And what I did, I don't remember about this patient, but normally from 2 to 4 passages of this lens, collimator lens, mode is 6.5 normally. And after change lens, here you can, it's not important. For me, that time I had only 2 millimeters. And in table I will show you parameters. I use 2 millimeter lens, and every element 2-3 times work with this lens. Yes. You have to explain your patient this protocol that their process can be acute after procedure. It's normal, it's okay. So it's better to combine this procedure with retinoids. Slow dose of retinoid, systematic retinoid, isotretinoin, for example, Roacutan 10 milligrams. It's safe, no complications. То есть вы можете комбинировать системные ретиноиды в маленьких дозах. Для чего? Чтобы избежать вот этого обострения после лазера. Роакутан. Yeah. 10. Маленький. Да.
ביום, או פעמיים בשבוע, בשלושה חודשים 10 מיליגרם ביום, ואז טיפול במקביל מהר.
One famous dermatologist all over the world, Goldman, you know, in 2017, make in JAMA Dermatology article that isotretinoin and acceptable timing of topical exposures. And in his research, it was an Aerolase nerve, like in my. But I didn't know about this article after I found in PubMed. So, in conclusion, systemic administration of isotretinoin is not hazardous in terms of skin complication when used in conjunction with laser skin treatment to achieve faster treatment result. Because when we treat our patients with acne or rosacea, it's very long. And patients don't want to wait. So actually, when you add systemic retinoids in low dose, you will not have complications, pigmentation, wounds, but result will be really faster. So when was time when I used only dermatological patients, I prescribed them for all of them retinoids. No one complication case. This patient is after second treatment. You see more calm skin. 3 procedures. 3 weeks after third treatment, she come for first procedure. And after just 4 procedures. And she sent me this photo. Yes, she lived with rosacea 15 years. Her husband in evening told her, "Dear, please remove makeup." She asked him, "I have no makeup." It was unbelievable even for her and even for me. Because we treat, skin with rosacea, it's very dense, it's very edematic, it's very inflammatory, it's very difficult skin, but we used only Aerolase, she was without retinoids, but some patients, of course, work with retinoids. And she sent me from home this photo and these parameters for her. F is a focus lens, C is a collimatory lens, and modes. Modes, this and this number of passes. Normally I use 3 passes. Now I little bit change my protocol. I use collimated lens from first procedures. So here you can see that I use why this protocol? Because it was my first treatments, and I was little bit afraid that with this lens, it was before my science research on mice, I could overhead skin and receive burns. So I used precise coagulation of inflammatory elements. But after a few patients, I start to use, like here, collimator lens from first procedures. It's safe. Understand? Okay. Here is my Instagram, my mail, my website. Actually, I have a school of regenerative medicine. It's a very big school on Russian language with English subtitles. It's a very big school about everything, what I know, what I make in my practice. It's really very interesting. So, WhatsApp Telegram if you will have questions. But I think that more interest is Instagram, because there you can find protocols, procedures, patients, many. Will, I have second presentation. Can you change? Maybe I will show, or yes, of course, yes. Parameters, I told you, yes.